is big time important for this. Because they're fat soluble, we also want to make sure that we're changing or exchanging good fats, good clean fats for the gunky fats, the things that have gotten glommed up with these mycotoxins. Because they are fat soluble, they can just go in and accumulate into those good fats in the body and make them a bad fat, make them a little harder fat or oxidized fat. And we make our hormones from fat. So we want to be making hormones from good, clean fats. So part of that oil change that we're trying to do in the body is to give the body really high levels of good, clean, healthy fats, and also give things that are a little bit bitter in flavor or even bitters as a supplement, so that we make and move more bile, because the bile is the thing that's going to capture that toxin. Then the bile goes into our gut and we want to grab the bile. So what are we binding in mold illness? We're binding bile, because the bile is where that toxin is.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. You may have heard that mold exposure can trigger allergy symptoms like a runny nose and scratchy throat, but did you know it can also create hormonal imbalances, including hyperestrogenic and thyroid disrupting effects? If you've listened to other episodes of the Woman's Doctor podcast or watched any of my Hormones, Health, and Harmony docuseries, you know how important it is for your hormones to function optimally. And because mold is a potential hormone disruptor that many of us are often unknowingly exposed to, I asked today's guest to come on the podcast to help us know if we have signs of mold exposure and what we can do to address both the mold and health issues. Dr. Jill Crista is my guest. She is a naturopathic doctor, best-selling author, educator, and innovator. Dr. Crista's books, memberships, and online courses support both patients and practitioners wanting concrete steps to address challenging health issues like mold toxicity exposures, PANS and PANDAS, and Lyme disease. She has helped thousands of people heal from mold-related illness. In today's interview, Dr. Crista shares surprising signs and symptoms of mold exposure, including skin issues, brain fog, infertility, and period problems. This is just to name a few. She explains how to know if there may be mold in your home or workplace and what to do about the mold, as well as how to address health issues resulting from exposure to mold with specific food, nutrients, and herbal recommendations. I also share how mold exposure played a role in my personal skin and health issues as a child and what helped resolve them. This and much more on today's episode of the Woman's Doctor podcast. Jill, it's so great to have you on the podcast. Welcome.
Thank you for having me. I'm super excited to talk about hormones and mold.
Well, mold is something that we definitely need to talk about. I don't think we talk about it enough. We talk a lot about hormone disrupting chemicals. We've talked a lot about those on the Woman's Doctor podcast, but we haven't really talked much about mold. And I think that a lot of times people just think of it, it's natural. It's just something that grows. We don't really have to worry about it, except that it smells bad, looks bad. So let's clean it up. But we have learned more and more in the recent years about the really detrimental health impacts of mold. So can you just start a bit about telling about, let's talk about mold. Is it all the same? Are there different types? What do we need to be really concerned about when it comes to mold?
Sure. There are some mold species that move into our homes. They're outdoor species, but they move in because they like the same environment as we do. They like about 70 degrees and they like a little extra humidity, which is usually how our homes are. The problem when they come inside is they don't have all the other natural forces that keep them living in a symbiotic way with the rest of the natural world. So they don't have sunlight in the indoors. We don't have air movement. We don't have little critters that drink up all the extra water. So in essence, this mold is now disconnected from even the fungal network, the mycelial network, that this beautiful web that basically rides underneath everything in nature and keeps an intelligence. But when we bring a mold spore into our homes, that intelligence and connection is lost. So it can have all the food it wants, and all it needs is a little bit of moisture. It doesn't need a flood, it needs humidity. So if it's over 60% humidity, that is a really great way to grow mold and become a mold farmer in your house. And then when it gets that lakefront property, it starts to act competitively because it's not connected to the wood wide web, as Paul Stamets calls it. So it will start to act competitively, and it will pump out these poisons called mycotoxins to compete out the other microbes in that environment. So they're the target, the other microbes are the target, but all of the things that toxin can do can affect us as well.
Okay. And so how would someone know if they might have a mold problem in their home? Because I think a lot of times people think, oh, I live in a dry environment, like I live in Utah. A lot of people have heard from people, oh, we don't have to worry about mold here, or Arizona, where it's also really dry. However, I have found out that there's some really toxic mold that grows all over the place, right?
Right. Yeah. And this is about what your indoor environment is. And we humans like the same indoor environment no matter where we are. So there are some areas where there isn't as much outdoor mold. So there's less chance of those spores to move into your indoor environment. But no matter where you are, if you are a human being, you're living at that indoor temperature. So you can get a mold problem no matter where you live. And mold is more than an allergy problem. So we think about, if you look on the CDC website, it basically describes mold spore illness, I call it, kind of just spore illness, because that would be like postnasal drip, sinusitis, hay fever, allergies, and maybe if it's really bad, asthma. And maybe if it's really, really bad, then it's aspergillosis of the lungs or an infection. So here's allergies way over here on the left, and then aspergillosis is way over here on the right. But then there's this whole in-between symptom picture that can happen from all the other things that mold can do to our bodies. So mold makes spores, but those spores, as they're living, off-gas, they're metabolic off-gassing, which includes alcohol. So you can be breathing moldy air and get drunk. That includes aldehydes, which makes you very chemically sensitive, especially to new materials, because those usually have formaldehyde on them. It'll pump out an immune suppressant that in medicine we use it's such a reliable immune suppressant that we use it for people who've had organs transplants to make sure that they don't reject that foreign material. Why would mold make that? Because it wants to move into you. It's trying to make sure it composts us. So this huge immune suppressant that you could be breathing in a moldy building can suppress your immune system to the point that it's just like you were taking the drug. It's unbelievable. And then there are those toxins. So the toxins are only made when the mold is trying to compete for its territory, but a little bit of that toxin goes a very, very long way. And what makes it very hard about this toxin is they are oil soluble or fat soluble, meaning they don't have to have any kind of carrier protein to come into the body. So a lot of other chemicals have to have some kind of doorway or protein or key or something that says, okay, you can come in the cell. Oh, you can't. But when something is fat soluble, it doesn't have to have that escort. So just by breathing it, you can take it into your respiratory passages, and then it goes really easily into the bloodstream, and it can go anywhere in the body. So when people say, well, what are the symptoms of mold? Well, that makes it a little hard to identify. That's why it's getting missed so often, because it can go anywhere in the body without an escort, and it can infect or affect any symptom. So Dr. Shoemaker, who I'm not Shoemaker trained, but I love the way he puts this, that mold is a multi-system, multi-symptom condition. And that's due mainly to the inflammation that the spores create, but also where those toxins can go. So I have a questionnaire, and you can get it on my website, that I've been using in clinic that helps you get a score to determine, is it possibly mold or is it probably not mold? But there are some kind of cluster symptoms I can go through kind of from top down. Mold affects the vision very, very much. And that's going to be both spores and mycotoxins. And by the way, I should say these toxins don't have any kind of odor. So someone could be being exposed to a moldy environment and not have any smell indicator. if everything's kind of trapped behind building material. So these mycotoxins, it's not necessarily that you're going to have that hit of like, oh, this is a damp building. And that's a little terrifying. So I tell my patients, like, okay, if your vision is changing a lot, so you put your contacts in or your glasses on, and throughout the day they're working and then they're not working and they're working and they're not working, that's kind of classic for a biotoxin illness like mold. Brain fog is a big one, fatigue, low-grade headache, or just feeling a little brain, like cognitively fogged, kind of buzzed, is how a lot of people describe it. You can get postnasal drip and clearing your throat a lot, or runny nose, hypersensitive lungs. So people will feel just kind of like their lungs are just irritated. And it can also make it hard to get over things. So if you've had COVID and you're in that long haulers place where the lungs are really affected, that we're seeing that as kind of a classic keynote for someone who has underlying mold illness. Usually there's some kind of gut disruption. So they went from having like, 2 healthy bowel movements a day, formed sinkers, and now all of a sudden the gut is starting to get bloated. Maybe you skip a day, maybe you have diarrhea. So there's usually some kind of gut change. A couple of keynotes that are mold related is ear ringing and bladder sensitivity. So if you have any of those things kind of adding up, and then you also have bladder sensitivity, you also have ear ringing, that puts us into a kind of a cluster that we would be thinking mold illness.
I think I've had just about every single one of those symptoms. And, and as you know, you've known me a while. For those of you who don't know, Jill and I went to medical school together. So we've known each other for a long time. And so my childhood, I had a lot of mold exposure. And so I think that has made me particularly susceptible to any kind of exposure to mold. So if I go into a hotel room, I will immediately start to feel, and so often I have a really incredible sense of smell. So sometimes I can smell things that other people can't smell, but even if I don't smell it, I know how I feel. So I'll start to feel tired. I start to get confused and moody. Now I know that that's what it is. As soon as I notice that, I tell my husband, like, we have to move right now, because the thing is that what has happened in the past is I've been like, I don't want to bother with it. And then I'm like, I'm too tired. So then I take a nap and then I wake up and I feel even worse. Right. So I'm like, I know I don't want to stay in that environment. Like, so as soon as I start to sense that, I'm like, we got to get out of here. We have to move. We have to find a new spot. And it's not always easy to do that, but
no, but I mean, it's beautiful to listen to yourself, because you pay for it. That's the thing I'm trying to have people understand, is that every bit of mycotoxin you are breathing in, your body takes on, because there's no stopgap, Yeah. And I forgot to mention skin. Skin is a huge one. Skin will often be the first reactor. So if they tend toward inflammation of their skin or acne, boom, especially certain types of mold that are more estrogenic, they will have an instant skin reaction or flushing or something like that. So trust those. Yeah, that's beautiful. I'm glad you do.
And I think that was a big part of my health journey when I was a kid too, is that why I had so many skin issues is because we had the first home I lived in, we had such a mold problem that I couldn't leave. My bedroom is in the basement, and I couldn't leave toys on the floor for more than a few days, or they would have mold stains on them, like dolls with like mold growing on them and stuff. And I would see little dots on the wall. The walls were painted white, and they would every now and then repaint them. And but we moved out of that home when I also made the connection with a holistic approach to medicine. So I think that everything that we did from a dietary and natural medicine perspective helped with addressing that mold toxicity that I had. And it's not something I really talk about a lot in my book and other things, because I think everyone has a journey for their skin and their health. And so I don't want people to automatically think everything is mold, but I also don't want people to forget about mold, because I don't think we talk about it enough.
Yeah, exactly. Yeah. Yeah. I remember when you told me that about the toys, and I was like, oh my goodness. How are you?
Like, we lived on a farm, and they're like, oh, it's just natural,
Right. It's from nature. Embrace it.
So thankfully we moved out of that home. But I also want to talk about hormones and the connection with, being endocrine disrupting. with mold effects. And then also, I certainly want to talk about what we can do about it, because I don't want to just talk about the problem all day.
Right, right. Yeah, so the two things I talked about, the categories of the off-gas chemicals of growing mold, and then the mycotoxins, which are mold defense, both of those tax the liver. And the liver is how we make our hormones. So we take cholesterol and we make them into these different hormones. So if you have a liver that's gummed up and is, kind of behind on its job, it will prioritize protecting you from toxin over balancing hormones. So we often see kind of a global hormonal imbalance. That's from all the indoor mold species. But there are a couple, and one of them is called zearalenone, that is an estrogenic. So it binds to the estrogen receptor and it activates it in a negative way. So it's basically creating like hyperestrogen symptoms, even though it's not estrogen. So it's bumping out your natural estrogen and it's like a hyperestrogen. So all of the hyperestrogen symptoms that we might see, like breast tenderness, PMS, and at the really severe level could be PCOS. You'll see a lot of skin breakouts, acne, that kind of thing. So this one mycotoxin, if we can get it out of the body, and then we have to do some things that are more kind of like the things that you would do to detoxify someone who has too much estrogen, like indo-3-carbinol, like DIM. Those are things that are specific for getting this mycotoxin out, because it looks just like estrogen. And the body says, oh, I know how to get rid of this. I know this estrogen thing, I just detoxify it through this molecule, which you can also get naturally through food, through the Brassicaceae family, like broccoli, cauliflower, the Brussels sprouts. Those are all things that can help with detoxifying that one mycotoxin. What to do about these mycotoxins? Detoxifying is a really important part. And the way that we detoxify them is they can go to our kidneys to get peed out. That's how we can test them on a lab test in urine, because the kidneys will filter out these mycotoxins. But some mycotoxins have a hard time getting detoxed through the kidneys, and they need extra bioflavonoids. This is so good for the skin. I know in your book, your first book, you talk about astaxanthin. And astaxanthin, zeaxanthin, anything in that color band of kind of the orange to yellow is really important for helping to bump those mycotoxins off a protein so that your kidneys can flush them out. So we hear a lot about binders, and we hear a lot about, this kind of thing with mold. While that's important, we also have to understand kind of what are the other ways that the body is trying to get that out. So through the liver, we can support zearalenone with the IC3 and DIM. The kidneys, we can support it with astaxanthin, zeaxanthin, rutin, quercetin, fisetin, that kind of color band. And what makes it easy is you don't have to know the names of all those things if you know what color to look for. So squashes are really great, yellow peppers, red peppers, or any kind of orange colored vegetable, so carrots. Those are all very mold supportive. And that sounds like a wonderful stir fry, doesn't it? I just named broccoli and, all the carrots. And yeah, so food is big time important for this. Because they're fat soluble, we also want to make sure that we're changing or exchanging good fats, good clean fats, for the gunky fats, the things that have gotten glommed up with these mycotoxins. Because they are fat soluble, they can just go in and accumulate into those good fats in the body and make them a bad fat, make them a little harder fat or oxidized fat. And we make our hormones from fat. So we want to be making hormones from good, clean fats. So part of that oil change that we're trying to do in the body is to give the body really high levels of good, clean, healthy fats, and also give things that are a little bit bitter in flavor, or even bitters as a supplement, so that we make and move more bile, because the bile is the thing that's going to capture that toxin. Then the bile goes into our gut, and we want to grab the bile. So what are we binding in mold illness? We're binding bile, because the bile is where that toxin is. We're so brilliantly and intelligently designed. We need all these fat soluble nutrients like vitamin D and vitamin A in the winter season so we can stay well, even if we don't have the food that supplies that. So we recycle a lot of our bile so that we can recycle those nutrients. The problem is, if you have a toxin that's that same kind of thing, then you're recycling the toxin, and that becomes what I call the definition of detox insanity. You see that toxin over and over again. The liver's like, I already saw this, I already packed it up in bile, here you go, try again. And then that toxin comes back up again. So it can really tax the liver, And that's where we can use things like turmeric and milk thistle that can help really nourish the liver and help it with that excess detox that it's trying to do. But the binders then, if we can bind bile, we're then taking a lot of that toxin out. And the best thing to do that is insoluble fiber. We learned from our mentor, Dr. Walter Krinian, in his book, Clean, Green, and Lean. He talks about this insoluble fiber as a very effective bile binder. And I went and dug into research that had nothing to do with mold and had to do with people who are missing their gallbladder, because a lot of times those people have trouble with too much bile coming into the colon. They can get diarrhea and loose stool and that kind of thing. In those studies, guess what they used to slow down the stool? Because it binds bile really well, insoluble fiber. So it's a great way to not only nourish your microbiome, but detoxify some of those mycotoxins. And then all the bioflavonoids. What's that?
Can you give an example about insoluble fiber? Like what?
Yeah, you bet. Yeah, it's important to give specifics. So people are like, what do I do? So a good old standard is psyllium husk. You can get a very clean psyllium husk that's pulverized really small. So it's not like drinking grit. You know, you can get that from a health food store. Metamucil is the one, you know, that people probably are more familiar with, but that's loaded with a lot of additives and things. So you're just adding your toxin burden. But at a health food store, you can get really clean psyllium husk and just stir 2 tablespoons into your water in the morning or your smoothie, and boom, you just done your biobinding. You don't have to worry about taking it away from your supplements. And because some of the binder conversation we get into the pharmaceuticals, it gets really complicated. You know, cholestyramine is one of the things we use pharmaceutically. Sometimes I will use that for patients who are really, really affected, but then it gets really tricky on timing it and that kind of thing. So psyllium husk is a very easy one. Flaxseed and chia seed, if you tend toward constipation and you need something with a little more mucilage, a little more thing that's gonna, you know, grease the skids, as they say. And you want to make sure these are all pulverized. So there's more surface area to pick up more of the bile. Another way to go would be if you tend toward constipation, you need kind of grease the skids a little bit. You need something with a little more mucilage. Then we can use flax and chia seed. And you want to make sure to pulverize this so there's more surface area to pick up the bile. Now, if you have SIBO, that's not going to work for you because those are things that are on the no-no list for SIBO. No problem. You can still use things that are insoluble fiber, such as sesame seeds, pumpkin seeds, and sunflower seeds. Those are all on the yes list on the first phase of Dr. Nirala Jacoby's biphasic diet. So they're allowed even in the most restrictive time. And again, all you need to do is pulverize those and sprinkle it over your food as you eat throughout the day. You've just done binding and you're nourishing yourself with things that support hormone balance.
Awesome. That's fantastic. Really great practical tips. And then you were about to mention another one that's really important. Yeah.
Yeah, I was just thinking that back when I was talking about all of the bioflavonoids, so the foods and that kind of thing, a lot of times hormone disruption is going to cause skin changes. So those are all things that also help nourish the skin. So it's really lovely. Like you can actually end up anti-aged after your mold exposure because you're now adapting all of these things into your diet.
Yeah. Yeah. And of course, one of the big things too is to avoid exposure to mold, right? To eliminate. And I think for me, that was one of the biggest things as a child, like just moving. And I know it's not always easy to move. But what are the things that people should look out for when it comes to mold in their homes, workplaces, and what can they do about avoiding exposure?
Yeah. So obviously if it smells bad, that's a problem. If you can smell a musty space, we smell through physical contact. If you think about it, like there's a nerve that comes from our brain to our nose, and then little bare fibers come down into our nose so we can smell. And what we're really doing when we smell is that little nerve, a molecule goes up and touches that bare nerve fiber. So it communicates by touching it. If it's a mycotoxin, they can scoop right up into that, and then they can end up in your brain. So we want to make sure, don't take on more. Don't take on more of the toxin. So if you smell anything, it's a problem. And you are taking on those toxins as you smell, because smell is a form of physical contact. I want to just repeat that because people you don't think about it because you don't see it, you know, but if you're smelling it, you're taking it into your body. No way, you know, we don't want that. So that would be number one, if there's a smell problem, but know that it's not always something you can detect with your nose, because if the building materials are all sealed, mycotoxins can still get through and they have no odor. So you want to be looking for water stains, rusting, bubbling of paint. A classic one in a work situation is a ceiling tile that has the yellow stain on it. So it shows it there was a leak at one point. Not all leaks grow mold, but a lot of them do. And a lot of them get, kind of brushed over, painted over, those kinds of things. We can see also like on floorboards, they'll pull away from the wall a little bit. So that would be something to look for. And then any standing water. I'm a big proponent of like shower squeegees and things like that, like drying the space. Also, anytime there's like a tub or shower and then flooring, if there's a gap and it's not caulked, that is a really common reason for having a mold problem, because it's the drips that get us into trouble. Also looking underneath anywhere where there's water. So underneath sinks, if there's any bubbling underneath that cabinet, underneath refrigerators, because we have the water line that goes to refrigerators. I'm so worried now about mold. I just unhooked all that from mine. We just do old school ice trays. Because I also found a lot of the refrigerator filters tested positive for mold. I was like, what? We're drinking water and getting dementia. No, thank you. So I'll just do ice cube trays.
Right.
Yeah.
Well,
so that would be a way to avoid.
Yeah, we just did a remodel in our home, and when we remodeled all the bathrooms, and when we did that, found out that they had never vented the bathrooms properly.
Right.
There were vents in there and they made noise, but they weren't actually
They weren't
hooked up
going
to the
anywhere.
outdoors. And
Yeah.
so no wonder I kept having to fight a mold issue in our basement with the ceiling, the tileless, and that bathroom. So I think of that as another one. It just being a simple thing of you've got to make sure that your bathrooms are well ventilated, because it's like we're showering, taking baths, most of us every day. And so that is a huge possible mold collector.
You bet. You bet. Yeah, venting is a big deal. Big deal. We have uber tight homes. So, once everybody became energy conscious in the 70s, we're seeing a rash of moldy homes from that era because everything got sealed up so tightly. So yeah, that's a big one. And I should mention there's thyroid is a really common problem. We talked about the hormones that get processed through the liver, and that's going to be more like our sex hormones, that kind of thing. But mold, the trichothecenes, which is like the toxic black mold mycotoxin, that interferes with the thyroid being able to be converted into its active form. So you can actually seem like you're hypothyroid, but you take your tests and your tests are normal. And a great way to test this is by giving your patient T3 only. So that's the active form. And if they get an improvement and they've had a water damage building exposure, you know that they are having trouble converting. And mold will also block iodine. So that's a basic nutrient that we use for making thyroid. So it's not always even just the liver type hormones that we're getting problems with mold. It's also thyroid. Yeah.
So when you're giving T3, you're saying that means that the body's just not converting it. And that's what the mold is preventing.
Yeah.
Thyroid. Okay.
T4 to T3 conversion. Yeah. Which gets a little technical, but for people listening, it's like we make T4, that's what's running around in our blood, and then it gets into tissues. And then when the tissue needs a little thyroid hormone, it'll convert it into T3, and that gives us our juice. That gives us our metabolism. So if you look down the list of hypothyroid symptoms and you're like, bing, 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 that's me, but my labs are normal, that could actually be mold behind that problem.
Right. And then another hormonal thing that I know you know about is infertility is another one with mold, right?
Yeah, both genders, actually. So many mold toxins and then mycotoxins. So both categories of off-gas metabolism and then the mycotoxins, but particularly the mycotoxins, they actually can damage the ovaries directly and the testes directly. And they can impede with testosterone formation, just like that one I was talking about that impedes with estrogen. There are a lot of mycotoxins that impede with testosterone formation. So we're having a rash of men who have very, very low T, and they have this water damage building exposure, or they're working in it. They're remodelers or something like that. And so they're doing these tear outs. Oh, we found mold again. And then, it's like, oh no, that should actually be done under containment. You should have respirator on, like protect yourself. But in that industry, there's such a machismo. They see it all the time, so it normalizes it too. And I cannot tell you how many remodelers and carpenters and builders that we've worked with to get their testosterone back on track just by treating their mold illness without having to do any other thing.
Wow.
Yeah.
Okay. And then going back to treatment, I know that there are also certain supplements and things. You mentioned DIM and, a few things, but, and of course, fiber and things like that as supplements, but anything else? I think antifungals, other supplements that you recommend?
Yeah, so I kind of have a pattern that I follow. I call it peeling the orange because when I thought about what it looked like when I sat down with a patient, I was kind of doing 5 basic methods. So avoidance is number 1. Obviously, you must get away from that exposure, remediate, do what you need to do, have your job change you from one building to another, one office to another, that kind of thing. And then the fundamentals, which is all the stuff we do in naturopathic medicine. It's like basic treatment guidelines, good, clean living, move your body, get to bed on time, drink good water, those kinds of things, and the diet. And usually I'm looking at like a low mold, mycotoxin, high binder diet. It's very effective, but diet alone typically doesn't do it. If you're already pretty symptomatic, you're going to need some extra supplements like extra fish oil for that oil change, extra liver support so that we can help the liver and kidneys process those toxins. Those are all things that get you ready for the 5th step, which is fight. What mold will do is it will change your flora. It changes your microbiome in your sinuses, in your respiratory passages, and in your gut to allow it to survive. It wants to come in and compost you. I mean, I said that earlier, which is kind of creepy. And so typically people who've been exposed to a water damaged building will have a fungal burden or fungal overgrowth on all of those tissues. And so I typically will do a whole body antifungal. The plants is usually where I start, and also an intranasal, because this is the start of it. This is our first interface with a moldy building in our sinuses. So if we're not treating that directly, that is seeding the gut every time you swallow. So that's a really important part of the treatment also. And there's some really gentle things that can be done. If you're working with kids who've been sick, they can use essential oil inhalation sticks. You don't always have to be sticking things up kids' noses. But typically, I'm looking at something like a nasal spray or a neti done on a daily basis. And typically, it's about 3 months or more to get that microbiome reset.
What kind of nasal sprays are you talking about? What would be in the nasal? Are you just talking about, because you said a neti pot, would that be like more like just saline, or is there something else stronger?
You want something more treatment, so you're not just watering it. So we might start in a less affected person. I treat anyone whether they have sinus symptoms or not, because that is the seed. I've learned that just by reading different studies. So I might start with probiotics, like Lactobacillus sacchii is one of the probiotics that's been well tested. You can get that at brands are Nasobiotex or Lantosinus. Those are really easy to administer, and sometimes just adding the probiotic makes the difference, resets the microbiome. Humic and fulvic acid, Dr. Zach Bush's Ion Biome, that's in a nasal spray that you can put into that. It's kind of like fertilizing the soil, and by doing that, sometimes that's enough and that resets it. And then we get into more treatment like propolis. We might use essential oils in the nose, like a tea tree or something like that. There are some wonderful mixes on the market. And if somebody's really sinusly affected, then we might need to go to pharmaceuticals in the nose. But propolis is one of my favorites since COVID because it has action against that as well. So it's antifungal, it's anti-inflammatory, it reduces histamine, and it has antiviral properties. It's a lovely thing to do. Yeah.
And I haven't heard of propolis as a nasal spray. Is that something you have to get compounded, or is that something you just
No.
get?
Yeah, there's a company called it's Nature and Nectar is the company, and their product is called Nasal Guardian.
Okay.
And there's also Manuka honey you can use. I'll use that for people who have a lot more histamine problems. So if they have spore exposure and the toxin exposure, they're going to have more allergic type symptoms. Yeah. You can use the ozone in the nose. I mean, there's all kinds of stuff you can do.
Yeah. That's amazing. So many different options for addressing that. So it's good to know that it's not something that we have to just suffer through, something to just struggle with. So,
no.
And you've been working with people for a long time, and also training other practitioners on how to address this, right?
Yeah.
So this has been so informative. I really appreciate it. Can you tell people where they can learn more about you, your books, and all that you have going on?
Thank you. Yeah, I'm at drcrista.com. That's drcrista.com. There you can get my clinical questionnaire so you can test yourself and get your own mold score. I have a book called Break the Mold that lays out everything I just talked about with doses and, even safeties so that, not everything is right for all people. Lays out the process of the peeling the orange and the whole thing. And then I have a new book that just came out called A Light in the Dark for Pandas and Pans. A lot of pandas and pans is from mold exposure. So this is like the extension of, okay, what if we had a really serious mold exposure and my child developed an autoimmune encephalopathy, which is pandas and pans? What do we do now? So I got a lot of those emails. And so the book is to answer that. And it's one of those things that you can, it has doses and it has safety measures and things like that. I also have a medication compatibility chart in there. So if your child does have to be on medication for those conditions, you know which herbs and nutrients you can use safely together. Mm-hmm. And then for courses, if you do have a kid in mold, I have a course called Mold in Kids. So you know how to take the things that I talk about in my book and adapt them for children, because not everything that you can do for an adult can you do with a kid. And kids need sometimes a little different administration. You can't always get everything into a kid through their mouth. So we do a lot of, foot things, foot treatments, skin treatments, because the skin is a little sponge. And if you're stuck in mold, in a moldy situation, some doctors, unbelievably, are saying, well, then I can't treat you till you're out of mold. No. There's a ton of things you can do. There's actually 9 things you can do if you are in a moldy situation. So I have a course called 9 Things to Know While You're Still in Mold, while you're working out your remediation and your work situation and that kind of thing. So you know what you can do to protect yourself. So when you get out of mold, you are much, much better and maybe even cured the minute you walk out of that.
That makes a lot of sense because it's definitely not easy to just move or get mold fixed.
It takes time. Yeah.
Yeah. And all right. Well, this has been so helpful, Jill. Thank you so much. Really appreciate it. And then everybody go check out her information, learn more about if mold is a problem for you and what you can do about it with her resources.
Thank you.
If you enjoyed this episode of the Woman's Doctor podcast, be sure to share it with the women in your life and rate and review the show. And to learn all about balancing your hormones, join us for the Hormones, Health, and Harmony 9-part documentary series at hormoneseries.com.